In the US every year, about 56,300 people are infected with HIV. Of these people, 34% are between the ages of 13 and 29. There are more people living with HIV and AIDS in the US than ever before, at 1.1 million people. This is most likely attributed to the longer lifespan of those infected afforded by anti-HIV medications. If you were to break those numbers down further, you would find that for every 9.5 seconds, someone is newly infected by HIV. What's scarier is that 21% of these people don't even know it. Since AIDS was first reported in 1981, more than 617,025 people have died from it in the US.
HIV has been around for more than 30 years, but a lot of people still don't know very much about the ways it can be transmitted, how the virus manifests itself, or how it can be treated. Some of the common myths about HIV are: I can get HIV by being around people who are HIV positive. I can get HIV from mosquitoes. I can't get HIV from oral sex. I could tell if my partner was HIV positive. I am HIV positive. My life is over. I don't need to worry about becoming HIV positive. New drugs will keep me well. If I am receiving treatment, I can't spread HIV virus. AIDS is genocide. My partner and I are both HIV positive. There is no need for us to practice safer sex. These common misconceptions create the stigma of HIV. If we learn more about the virus, we can prevent fear and judgment associated with HIV.
HIV is thought to have originated in non-human primates in sub-Saharan Africa sometime around the late 19th century. There is evidence that humans who participate in hunting of wild animals in West and Central Africa first acquired the disease. There are many theories on what factors promoted the initial spread of HIV, including social changes following the colonialism, rapid transmission through unsterile injections, unsafe smallpox vaccinations, and prostitution. The first clinical cases of AIDS were observed in 1980, when drug users and gay men presented with a rare form of severe pneumonia. Originally, in the press, AIDS was known as GRID, or gay-related immune deficiency. Then, the Center for Disease Control coined the term the 4-H disease, claiming it singled out Haitians, homosexuals, hemophiliacs, and heroin users. In 1982, the term AIDS was finally introduced. DNA provides the information necessary for cells to produce essential proteins. First, the DNA messages are copied into a different form called RNA. Based on the specific instructions described by the RNA, the cell will construct a chain of the protein building blocks collectively called the amino acids. Viruses lack the ability to synthesize their own proteins independently. They must piggyback on the host cell's normal processes. Mutations are mistakes made in the construction of a protein. Substitution of one for another will cause slight changes in the overall protein. One mistake-changing protein may have a slight advantage over another in resisting the effects of a particular HIV drug. For this reason, patients must take a mix of drugs that interfere with many stages of the viral replication cycle so that no one mutant can thrive and take over.
Viruses act by hijacking the host protein synthesizing machinery and using it to make proteins that are crucial to viral proliferation. This is achieved by the virus binding to the host cell and injecting its genetic material in from outside the cell membrane that is then integrated with the host cell's genetic material. The cell continues making proteins, unaware that it is now synthesizing viral ones. When a substantial amount of viral proteins have been made and viral genetic material copied, these are assembled into new viruses that are then released from the cell and will go on to infect other cells. HIV is a retrovirus, which means that the genetic material it contains is not DNA, but rather a molecule called RNA. RNA must be changed into DNA before it can be integrated with the host cell's DNA. This added step is notorious for making mistakes, and these mistakes are what cause a high mutation rate and resistance to medications.
HIV can be transmitted through 5 fluids that contain high concentrations of the virus. These include vaginal fluid, preseminal fluid, semen, and breast milk. Any interaction where these fluids are exchanged or absorbed into the bloodstream provides an avenue for HIV transmission. Casual contact, such as kissing, hugging, and other day-to-day interactions, pose no threat of transmission. So remember, kids, cover the stump before you hump.
Proteins on the surface of a mature HIV virus recognize proteins on the surface of the target cell. Once these proteins have been targeted, they bind together, causing the viral membrane to fuse with the host cell's membrane, projecting a viral capsule into the host cell's cytoplasm. That capsule is then degraded, and two full-length, single-stranded viral genomic RNA and some proteins are released into the cytoplasm. Single-stranded viral genomic RNA is then converted into double-stranded DNA by a protein called reverse transcriptase. Double-stranded viral DNA is then imported into the host nucleus and integrated into the host genomic DNA by a protein called integrase. Once the viral DNA has been incorporated, it is turned into encoding molecules called messenger RNAs by the host cell's machinery. Some of those messenger RNAs are cut up and recombined. This process is called splicing and is completed by a RNA-protein complex called the spliceosome. Full-length messenger RNA and spliced messenger RNA are then exported back into the cytoplasm in molecules called transfer RNAs. In cooperation with RNA-protein complex called the ribosome, read that messenger RNA and produce viral proteins. These viral proteins then assemble and recruit the full-length messenger RNA, which is in fact the same as the single-stranded viral genomic RNA we began with, and begin to encapsulate the genomic RNA and some proteins to prepare for leaving the cell. Once everything has been collected and encapsulated, the virus buds off the host cell using the host cell's membrane as its own. This releases an immature virus that can then be matured by the processing of proteins. Once the virus is matured, it can infect a new target cell, and the process is repeated.
There are many tests for HIV infection. The most prominent is an enzyme-linked immunosorbent assay that detects HIV antibodies in saliva or blood. There's a window period where after being infected, you will not show signs of antibodies for up to 3 months. If you do test positive after a 3-month period with a given ELISA, a secondary test is implemented, typically a Western blot that is more accurate to confirm infection. Rapid tests can also be done that take 20 minutes or less, such as OraQuick, which only requires an oral swab. Other forms of testing detect viral antigen levels, such as capsid protein 24. One last test is the polymerase chain reaction, which shows whether viral genetic material is present or not, but ELISAs are the way to go.
Individuals infected with the HIV virus have a compromised immune system and an increased risk of infection. Common opportunistic infections in HIV patients include pneumonia, tuberculosis, hepatitis C, and the human papillomavirus. Regular treatment with antiretroviral drugs can dramatically reduce the risk of these infections. Poor dental and skin health are also symptoms of the HIV virus. Twice-a-year dental checkups are recommended for HIV patients to reduce the risk of bacterial infection. Additionally, proper nutrition and physical exercise are essential to maintaining a healthy immune system, as well as good mental and emotional health. HIV infection can have more than a physical effect on a patient, and newly diagnosed patients often struggle with the emotional implications of their infection.
When it comes to infants, transmission of HIV can occur through either childbirth or breastfeeding. However, this can be prevented by using drugs that stop the reverse transcription of HIV. If a mother is HIV positive and wishes to give birth to an HIV-negative child, planning ahead is required. If the father of the child is HIV negative, it is important to use protection at conception. This involves using artificial insemination. If the mother chooses to take no preventative drugs and breastfeeds, then the chance of her baby becoming infected is around 20 to 45%. Modern drugs are highly effective at preventing HIV transmission during pregnancy, labor, and delivery, reducing the chance of having an HIV-positive child to only 2%. The mother must also use formula feeding, and the child must be tested at intervals after birth for HIV.
HIV medication is applied in what is now called a HAART therapy protocol, which is a highly active antiretroviral therapy protocol. This is a method where you use 2 or more different types of HIV drugs that aggressively suppress the HIV virus. There are 5 basic drug types. Nucleoside reverse transcriptase inhibitors, like AZT, are incorporated in the growing genetic genome of the viral DNA. Once they are incorporated, they abort the reverse transcription process. The other reverse transcriptase inhibitor works by directly binding the reverse transcriptase enzyme and stopping transcription that way.
Another drug type that we have are fusion inhibitors. Fusion inhibitors work by preventing the virus from fusing into the immune cell. Right. And we also have protease inhibitors. Protease inhibitors work by inhibiting the enzyme protease from cleaving the viral proteins into smaller pieces that the virus needs to replicate itself. The last type of drugs that we have are integrase inhibitors. Integrase inhibitors work by preventing the enzyme integrase from inserting the viral genome into the host's DNA, thereby using the host machinery to make copies of itself.